Osteopathy is really about creating balance in how the structure is functioning. And that's what we see with low back problems. When it's not functioning properly, you get a problem. So that's what osteopaths do. They make sure that all of the body is working properly, because with a low back problem, it may actually start from an ankle, a knee or a hip. It's not always starting just in your low back. That's just the bit that's become injured. So we have a very good understanding of how the whole body works.
I'm looked after by an osteopath who gets into my back and massages it at least once or twice a week. I get manipulated quite a lot because my back gets stiff, which helps a massive amount.
You first of all get an idea and an understanding from Nick where he feels he is. So you've got to ask him loads of questions, you've got to kind of find out what's happening in his life, and you've got to understand what he's doing with his body and what he wants to do and whether that's a reasonable idea for him to do it. Just drop down to your right side now, so let this arm. So when we get on to the treatment side of things, what we're doing is we're looking to try and find areas that we feel are contributing to the symptoms he's getting. We're looking to see how well the body actually moves and functions. That can be gross movements or it can be quite sort of subtle things, but all the time we're looking to try and improve that mechanical functioning of his body.
We work with our hands, so the trademark of an osteopath is palpation. We're very, very good at interpreting the tissue beneath our fingers. If we've got muscles which are tight, using deep soft tissue massage techniques is going to help. Stretching those with articulation is going to help. Looking at the joints in the back, these facet joints, sometimes they get really stuck together, and we can use gentle, high velocity thrust techniques which help those joints loosen up, okay? So people enjoy that. Sometimes when you often hear the pop or the click.
So what we're going to do now is trying to find that position or that stretch or that exercise that is just going to allow the body just to go, oh, thank you.
Oh, first time I've been out of pain for 30 years. And I'm 63 now, so I spent a lot of my time in pain, and that's all gone, which is wonderful.
Helen also gave me some exercises to do to help with relaxing.
Nice stretching exercise, stretching out the low back, moving the hips, stretching the arms and shoulders. These are some of the basic stretches. And then we use some resistance bands, which are a nice way of developing some strength, core strength, strength around your shoulder blades and your low back.
I feel as if I've had my MOT and I feel really just as if I'm on a little cloud.
And moving forward as a full-time athlete, I probably couldn't do what I do day on day without osteopathic treatment. So yeah, it's good.